for students, you must understand hypertrophy of the heart. It's very often, because for a lot of people you see atrial hypertension, yes, and hypertrophy of the heart. In this situation, you see problems with valves, yes, valvular diseases and hypertrophy too. Or this is, yes, if you say about mitral stenosis, yes, hypertrophy again, hypertrophy. If you see increased cavity of left ventriculus, maybe eccentric. If you see decrease, concentric. Concentric, maybe without a lot of clinical symptoms. Patients don't, without complaints of maybe. But if you say about eccentric, in this situation, cavity big, you see a lot of problems, especially with lungs, with another organs, because think about heart failure, insufficiency, right or left-sided heart failure, so and a lot of problems.
So that is eccentric, right?
Yes, if you say about VCs, in this situation haven't cavity, because first time may be concentric, but second stage may be eccentric. Yes, not haven't first time concentric or eccentric. Yes, first time may be compensation, after maybe decompensation. But if you have problems, yes, you have stages. Yes, and last stages you see decompensation of organs in this situation. For students, you must remember about sickness, most stable for hypertrophy and normal size. You must first time see sickness of the wall. Normally, for right ventriculus sickness, do you remember? Толщина правого желудочка for people. The thickness of right ventriculus. Maybe 2-3 millimeters. Left ventriculus
5-7.
maybe more, 10-11 sometimes. Yes, 10-11. Why? All of us remember why?
Has to pump more blood for
Yeah,
systemic.
because work more. Yes, a small cycle, big cycle, it's another work. And for patients with hypertrophy, thickness increase. If you have, for example, in this situation, yes, left ventricular thickness may be, for example, more than 15 millimeters. Yes, thickness of the myocardium. It's hypertrophy. And after you must describe cavities, it decrease or increase. Because only if you have mass of the or mass or weight of the heart, it's not necessary hypertrophy if you have, for example, 350. Because you remember sometimes our heart, yes, discuss likes with our fist. Yes, but some people maybe, for example, with small, with yeah, some people big, some people small, yes, and size of the heart may be another, yes. But thickness stable. Thickness stable. If you have more than 12 millimeters, hypertrophy. It's okay. It's okay. Again, see, this is. For you, yes, it's another cut of our heart, maybe left ventriculus and right ventriculus. It's concentric, yes, small cavity of the left ventriculus. In this situation, eccentric, yes, maybe big cavity. Decompensation, compensation. With normal heart, for example, yes, with hypertrophy of the heart. Hypertrophy of the heart. And this is healing, but it's not beautiful, but you have this. If, for example, muscles, this is area with scar. After myocardial infarction, you see regeneration, but without new cardiomyocytes. You haven't growth of new cardiomyocytes. You see hypertrophy of cardiomyocyte near, but area after injury with with growth of scar tissue. Yes, cardiosclerosis. Cardiosclerosis. Okay, and see this is if you say about this part. About this part. Okay, a lot of compensatory processes, and for students, again, maybe this is concentric, yes, hypertrophy, this is big heart, or this is heart again, eccentric, yes, cavity enlargement, very big cavity. Sometimes like with animals' heart. For people, yes, maybe 300 grams, yes, 350 maybe, it's very big. But it's normally, but in this situation maybe near 1 kilogram. It's like with bisons, the bison heart, yes, elephant maybe, no, but you cannot in people, it's very big, yes, but you see, it's, for example, this is hypertrophy. It's normal hypertrophy, yes, heart. Besides today, again, for kidney, you say a lot of kidney. This is hydronephrosis. Yeah, some students think about bowel, yeah, about bowel, yes, about intestine. It's kidney, yes, kidney, big kidney, but this is cavity. It's all of this after hydronephrosis, atrophy of the parenchyma, and absence of normal tissue, function absent too. Treatment in this situation, maybe hemodialysis, yes, or a transplantation. Transplantation is very good, yes, but expensive. For heart, it's maybe two. Maybe transplantation of the heart, a new heart, new life. But again, expensive. For brain, today you have a transplantation. Yes. Brain stable, yes.
So maybe sooner brain transplant also be.
If you say about brain transplantation now,
Sooner.
in future maybe, yes, it maybe every day you have new, yes, new. Sometimes you see some cells with increased regeneration of some part of the body. Okay, this is interesting too. For example of hypertrophy, this is thyroid. Yes, thyroid. Yes, and you see hypertrophy of thyroid, names of is goiter. Yes, maybe tumors, with adenomas, maybe cancer, but maybe goiter. Goiter is situation with hypertrophy of our thyroid because problems easy, iodine deficiency. Yes, for example, in Belarus you have problems with iodine, absence of the sea, absence of the fish with iodine, a lot of, yes. But in Sri Lanka, a lot, yes. Maldives, India, yes, Indian Ocean, yes, and problems with endemic goiter absent, increase in size, big thyroid, maybe names goiter, examples of hypertrophy. Big organs, increase production of hormones. All of us remember how many hormones by our thyroid? Thyroxine.
T4.
Yeah. And if you have a normal function, yes, T3, T4 and calcitonin. Yes, and calcitonin. You see problems with T4, for example, a lot of T4 and problems with another organs. For example, in patients with a lot of hormones, maybe growth of the heart. Yes, maybe hypertrophy and increased blood pressure. Yes, thyrotoxicosis. Or another problems. If you have low level, some problems, maybe decrease atrophy. Our hormonal regulation, it's very difficult but easy. Yes, if you have some problems with one, maybe problems with another. Yes. How many slides today? 3 slides. Okay. And keloid scar. Ankyloid skull. Okay, and last questions about us, about our group. Yes, have you